Good morning to all. Today's topic is endocrine disorders. Okay. Last class we were discussing about endocrine disorders, adrenal glands, Cushing syndromes, Addison diseases. Today we are discussing about diabetes mellitus. Okay. Diabetes mellitus is a metabolic disease characterized by abnormally elevated blood glucose levels and dysregulation of carbohydrate, protein and lipid metabolism. Okay. Classification of diabetes mellitus. It is two types, type 1, type 2. Type 1 is insulin dependent diabetes or juvenile diabetes. Type 2 is non-insulin dependent diabetes or adult onset diabetes. Okay. Next, gestational diabetes. It is pregnancy diabetes. Other types of diabetes is genetic defects affecting beta cell function or insulin action. Pancreatic diseases or injuries like pancreatic cancer, pancreatitis, traumatic injury, cystic fibrosis, pancreatectomy. Okay. Infections like congenital rubella, cytomegalo infections, okay, Coxsackie viruses, mumps, Epstein-Barr virus, infections. Drug-induced diabetes like steroid hormone, thyroid hormone. Okay. Next, endocrine disorders or hyperthyroidism, Cushing syndrome, acromegaly, pheochromocytoma. Okay. And other genetic syndromes with associated diabetes. Okay. Other genetic syndromes. What are the other genetic syndromes? Down syndrome. Examples are Down syndrome, Turner syndrome, Klinefelter syndrome. Okay. This is the classification of diabetes mellitus. Okay. Next, type 1 diabetes is absolute insulin deficiency dependent on exogenously insulin for survival. Okay. Next, autoimmune destruction of pancreatic beta cells and some viral infections can cause. Okay. Type 1 diabetes is sudden onset. Less than 25 years patients are involved. Individuals are of normal weight or thin in stature. Highly susceptible to diabetic ketoacidosis in type 1 diabetes patients. Next, type 2 diabetes. It does not involve autoimmune beta cell destruction. Okay. Characterized by the following three features. First, peripheral resistance to insulin, especially by the muscle cells. Second one, increased production of glucose by the liver. Next, altered pancreatic insulin secretion. Okay, these are the three types of characteristic features of type 2 diabetes. Okay, risk factors are obesity, advancing age, inactive lifestyle. Okay, genetic influence is more. Type 2 diabetes usually has a slow onset and may remain undiagnosed for years. Type 2 diabetes do not require exogenous insulin. Type 2 diabetes resistant to diabetic ketoacidosis. Next, gestational diabetes or pregnancy diabetes. It occurs in approximately 4% of pregnancies. Okay. During third trimester, glucose intolerance during third trimester. Gestational diabetes return to normoglycemic state after parturition. Okay. About 30 to 50% of women with a history of gestational diabetes will develop type 2 diabetes within 10 years. Diagnosis. Okay. Signs and symptoms of undiagnosed diabetes. Okay. Polydipsia means excessive thirst. Okay. Excessive urination, medical term polyuria. Excessive hunger is polyphasia. Okay. Unexplained weight loss, changes in vision, weakness, malaise, irritability, nausea, dry mouth, ketoacidosis, periodontal disease, paresthesia, loss of sensation, postural hypotension, poor inhaling, gingival bleeding. These are the signs and symptoms of diabetes. Okay. Next, investigations. Investigations or oral glucose tolerance test, OGTT. Okay. Fasting blood glucose level. Okay. FBS ante fasting blood glucose level. ఎంత ఉంటుంది నార్మల్ వాల్యూ లెస్ దెన్ 110 milligrams per deciliter. Okay, next postprandial blood glucose level PPBS. Okay, normal level less than 140 milligrams per deciliter. Okay, next random blood glucose level RBS is less than 160 milligrams per deciliter. Urinary glucose analysis, glycosylated hemoglobin assay. Okay, glycosylated hemoglobin assay is less than 8%. HbA1c less than 6 to 6.5%. Okay, these are the investigations of diabetes patients. Next, self-blood glucose monitoring. This is one type of investigating method, SBGM. What? Glucometer. Okay, a small drop of capillary blood from a finger stick. Sample to assess glucose levels within seconds. Okay, these are the steps. Okay, glucometer and steps. Next, oral manifestations of diabetes. This is very important for your exams. Oral manifestations of diabetes mellitus is 4 marks question. Okay. Xerostomia, burning mouth, oral dysesthesia, altered wound healing, increased incidence of bacterial, viral, fungal infection. Multiple periodontal abscess, silladenitis, especially parotid areas. Okay, see the periodontal abscess. Okay, here gingival infections, abscesses there. Okay, next, hyperglycemia. Hyperglycemia is increased glucose clavicular fluid or glucose levels, blood glucose levels are increased in hyperglycemia patients. Next, change in the interaction between cells and the extracellular matrix within the periodontium. Okay, altered periodontal wound healing seen in hyperglycemia patients. Okay, next, management. Next, oral agents of type 2 diabetes patients. Sulfonylurea agent, non-sulfonylurea agents. Tretinoin ripaglinite. Okay, biconides is trade name. Generic name is metformin. Thiazolidinediones. Okay, generic names troglitazone, rosiglitazone, pioglitazone. Okay, alpha glucosidase inhibitors, acarbose. Okay, next, diet, exercise, weight control and medications is given, is must for type 2 diabetes patients. Next, dental management. Previously diagnosed but poorly controlled diabetes. Okay, establish the level of glycemic control early in the treatment process. Glycated hemoglobin values less than 8% is good glycemic control. Okay, greater than 10% is poor control. Use fluids without dextrose. Okay, use the normal salines. Poor glycemic control. Antibiotic prophylaxis prior to surgical therapies. What are the names of antibiotics? Tetracyclines, penicillins. Okay, next, corticosteroids are contraindicated. Okay, should always be instructed to take their insulin and eat a normal breakfast before routine dental appointments. If procedure is extensive or stressful, give more insulin. Okay, appointment should be kept morning times. This reduces risk of perioperative hypoglycemic reactions. Next, treatment of hypoglycemia. Patient is awake and able to take food by mouth. Okay, 15 grams oral carbohydrates, 4 to 6 ounce fruit juice or soda, 3 to 4 tablespoons table sugar, hot candy sugar. Patient is unable to take food by mouth. 25 to 30 ml dextrose, 50 intravenously. Patient is unable to take food and intravenous is not possible. Okay, that is 1 milligrams glucagon subcutaneously or intramuscularly given. Next, following treatment. Signs and symptoms should resolve in 10 to 15 minutes. Patient should be observed for 30 to 60 minutes after recovery. Ensure that normal blood glucose levels have been achieved before the patient is released. Hyperglycemia may present with symptoms mimicking hypoglycemia. If glucometer is not available, it must be treated as hypoglycemia. Thank you. This is the diabetes mellitus. Next class, we're discussing about hormones, pituitary, thyroid, parathyroid. Okay, thank you.